They wanted to talk about, Jacob could probably introduce this better, but the CDC tightening guidance for U.S. healthcare workers. The main concern from the United States here is that many of our healthcare workers have been infected, which has led to a countless number of people being quarantined and stuff like that. So we want to get a more tighter scrutiny on how hospital workers and stuff prepare. And Jacob will tell you more about it. But can you see the screen?
Yes, but the font is quite small.
Okay, well, I can fix that. Is that better?
Yes.
Read it out, Jacob. Read that to them, please. Whereas Centers for Disease Control, you see that one? Okay, go, read out.
Whereas the Centers for Disease Control and Prevention, or CDC, is tightening previous infection control guidance for healthcare workers caring for patients with Ebola to ensure there is no ambiguity. The guidance focuses on specific personal protective equipment, or PPE, healthcare workers use and offers detailed step-by-step instructions for how to put the equipment on and take it off safely. Whereas recent experience from safely treated patients with Ebola at Emory University Hospital, Nebraska Medical Center, and National Institutes of Health Clinical Center are reflected in the guidance. Whereas enhanced guidance is centered on 3 principles. First, all healthcare workers undergo rigorous training and are practiced and competent with PPE, including putting it on and taking it off in a systematic manner. Second, no skin exposure when PPE is worn. And last, third, all workers are supervised by a trained monitor who watches each worker putting PPE on and taking it off. Whereas all patients treated at Emory University Hospital, Nebraska Medical Center, and National Institutes of Health Clinical Center have followed the 3 principles. None of the workers in these facilities have contracted the illness. Be it enacted, the following protocol be established in all hospitals in the United States, immediately based on the following 3 principles. Principle 1, rigorous and repeated training. Focusing only on PPE gives a false sense of security, of safe care, and worker safety. Training is a critical aspect of ensuring infection control. Facilities need to ensure all healthcare providers practice numerous times to make sure they understand how appropriately to use the equipment, especially in the step-by-step putting on and taking off PPE. CDC and partners will wrap up training offerings for healthcare personnel across the country to reiterate all the aspects of safe care recommendations. Principle 2, no skin exposure when PPE is worn. Given the intensive and invasive care the U.S. hospitals provide for Ebola patients, the tightened guidelines are more directive in recommending no skin exposure when PPE is worn. CDC is recommending all the same PPE included in the August 1st, 2014 guidance, with the addition of coveralls and single-use disposable hoods. Goggles are no longer recommended as they may not provide complete skin coverage in comparison to the single-use disposable full face shield. Additionally, goggles are not disposable. They may fog after extended use, and healthcare workers may be tempted to manipulate them with contaminated gloved hands. PPE recommended for healthcare workers caring for patients with Ebola includes double gloves, boot covers that are waterproof and go to at least mid-calf or leg covers, single-use fluid-resistant or impermeable gown that extends to the least mid-calf or coverall without integrated hood, respirators, including either N95 respirators or powered air purifying respirator, PAPR, single-use full-face shield that is disposable, surgical hoods to ensure complete coverage of the head and neck, and last, an apron that is waterproof and covers the torso to the level of the mid-calf, and it covers the top of the boots for boot covers. To be used with Ebola patients that have vomited or have diarrhea. The guidance describes different options for combining PPE to allow facilities to select PPE for their protocols based on availability, healthcare personnel familiarity, comfort, and preference while continuing to provide a standardized high level of protection for healthcare personnel. The guidance includes having first 2 specific recommended PPE options for facilities to choose from. Both options provide equivalent protection if worn, put on, and removed correctly. Second, designated areas for putting on and taking off PPE. Facilities should ensure the space and layout allows for clear separation between clean and potentially contaminated areas. Third, train observer to monitor PPE use and safe removal. Fourth, step-by-step PPE removal instructions that include disinfecting visibly contaminated PPE using an EPA-registered disinfectant wipe prior to taking off equipment. And last, disinfection of gloved hands using either an EPA-registered disinfectant wipe or alcohol-based hand rub between steps of taking the PPE off. Principle 3, the train monitor. CDC is recommending a trained monitor actively observe and supervise each worker putting PPE on and taking it off. This ensures each worker follows the step-by-step processes, especially to disinfect visibly contaminated PPE. The trained monitor can spot any missteps in real time and immediately address it. PPE is only one aspect of infection control. It is critical to focus on the other protection prevention activities of all the spread of Ebola in healthcare settings, including limited to first, prompt screening and triage of potential as patients. Second, designated site managers to ensure proper implementation of precautions. Third, limiting personnel in the isolation room. And last, effective environmental prevention. With that, that's the conclusion of our initial proposal for addressing the Ebola outbreak in healthcare scenarios.